For some people who take birth control, specifically the combined hormonal contraceptive, we see some of the same effects hormonally as we see in like postmenopausal women, where we get an atrophy of the tissue, we get an increased sensitivity of those nerves. It's not that everybody who takes the combined hormonal contraceptive is going to have that. It tends to be that specific people who have a genetic predisposition to that and then also take that, the birth control pill, tends to uncover an underlying issue. And the only real study on treatment for this specific type of vestibulodynia that there is by Burrows and Goldstein in 2013, where they take specifically people who have this type of vestibulodynia. So specifically vestibulodynia that was contributed to or potentially caused by the birth control pill, and they excluded any other type of vestibulodynia, so any that was caused by a tight pelvic floor, inflammatory, or like repeated infections, they excluded those. And they treated it by taking them off the birth control pill and giving them a compounded estradiol and testosterone cream. And the patients did overall very well. So most of them responded really well. They had decreased pain with this treatment. We don't really know necessarily if some people are able to stay on the birth control pill and be able to get the same amount of improvement with just doing the topical cream. However, in his textbook, Goldstein does say that clinically, he generally sees that people who stay on the pill don't tend to see the same improvements as people who get off the medication. In real life, many people have contributing factors for multiple different things. They may have issues with pelvic floor dysfunction, they may have issues with inflammatory, they may have some hormonal pieces to it, and so it's hard to say what treatments are going to work for each person. I think there is going to be a subset of people who does not necessarily get better without going off of the medication that's causing the issue or contributing to the issue. But there may be a subset of people that is able to stay on the birth control pill, get specific compounded hormonal medications, do pelvic floor physical therapy, etc., and be able to see progress even without getting off of that medication.